Welcome, everyone, to Planetary Health First, Mars Next. Tonight, we have a special guest, Doug Sullivan. He's going to be leading us through a really deep and exciting conversations on digital health, what it means to be a digital care manager. You're probably thinking, what the heck is that? Well, he has many years of experience as a case manager, as an RN. Doug, can you tell us a little about yourself and what you're excited about talking tonight?
Well, I'm really excited about sharing this transition that we're heading towards with healthcare, and practices are starting to realize that they can use technology to fill those gaps, to make up in the areas that it's been very frustrating for patients and very frustrating for them, and kind of bogging them down. And we saw the first utilization of this with practices embracing telehealth. And even though telehealth had been around for years and years, we saw that hey, we can use this for during COVID when patients are not coming into the office. So that's kind of gone. That was a dabble into technology, if you will. All of the EHRs started ramping up and offering telehealth to those practices as part of their EHR suite. But then we saw a whole influx of tech companies that said, why not use it less expensive telehealth platform through us? And we can offer all these other RPM type platforms. So what RPM is remote physiological monitoring, or some people just call it remote patient monitoring. And that lets you add a simple device, whether it's a smartwatch, whether it's a pad that you lay on your bed and it checks your sleeping and your respirations and your heart rate at night, or a blood pressure cuff or a glucometer,
All right.
continuous
So,
glucose.
Doug, are we going to hear some more about this tonight?
Yeah, yeah, that's a lot of information.
So, what is
Well,
the one thing that you're excited about in this future of all these devices, connected devices?
the one thing I'm excited about is I think this will be an area where physicians and nurses can migrate to get that quality of life that they wish to have, because now they work from home and there's a lot of opportunity to work from home and have that higher quality of life when they were really getting burnout at being at the bedside or being in the outpatient practice. And a lot
Awesome.
of they could do
Awesome,
the
Doug.
combination.
Well, if you are a physician, if you're a provider, if you're a healthcare administrator, if you're in pharma, you name it, across healthcare, Doug is going to be leading us in an amazing conversation tonight. And we look forward to your discussion, your input. This is a dynamic place here at Planetary Health First, Mars Next. And Doug has, gosh, he can tell you how many years, over 20 years leading case
Over 20
management.
years, yeah, and we've been doing it the old-fashioned way. We were just calling patients at home and filling the gaps that way, but now we can use technology and integrate that in.
Awesome. Thank you so much, Doug. And I look forward to having a great time talking tonight and learning from you.
All right, thank you.